Completing a psychosocial assessment is usually one of the first interactions an oncology social worker will have with a patient. In social work school and in social work trainings, we hear a lot about building rapport in order to start a therapeutic relationship, and this truly is very important when working with oncology patients. Usually people who are recently diagnosed with cancer have a lot of interactions in the medical setting, lab work, tests, scans, invasive procedures, and sometimes meeting with a social worker is one of the first interactions that they'll have that doesn't involve physical contact, invasive procedures, and it really could be one of the first interactions they have that's truly individualized emotional support as they go through their diagnosis and treatment process. A psychosocial assessment contains important information that social workers can use to help create social work interventions, guide social work practice, provide advocacy and resources to patients as they go through their treatment process. On this page, you'll find an example of a social work psychosocial assessment that can be used when you're meeting with a patient for the first time. You can tweak it or change it or add different elements that are important to your practice setting. Each category is also broken down into explaining why each topic is important and some sample questions that you can use to explore these different topics with patients. Meeting with newly diagnosed patients can be a little bit intimidating, especially if you're newer to the social work field. So I hope you can use this page to help guide your assessment process to make your first interaction with your patient a bit more fluid, a bit more comfortable, and ultimately result in a good start to a relationship with your patient.